Hi and hello. This is Dr. Gururam, periodontist. Basically, we periodontists will be dealing with the surrounding structures of the tooth. So, I'll be briefly talking about toothbrushing techniques today. We'll be demonstrating the toothbrushing techniques, how effectively we care for the gums, and how effectively we remove the plaque or the debris which are present on the gums. So before we start with the toothbrushing techniques, brushing of teeth is an important routine dental care where it depends on two frequencies. One frequency of how often you change the brush, and second frequency how often you brush. One thing, how we'll change the brush mostly. Some will say we'll be changing the brush after 8 months happens. And the second thing, the frequency of brush changing a brush should be 3 to 4 months max at the max. And second frequency is how often you brush. Morning only, will be doing the brushing only in the morning. Why? Because we'll go to the office, we'll go to whatever job we are doing. In a hurry, we'll do the brushing, and we'll push off from there. So even for the toothbrushing, we have a lot of research going on. Brushing techniques, mostly to my knowledge, there are only 9. It goes like this. One is Bas technique or sulcus cleaning method. Second is modified Bas technique. Third is modified Stillman's technique. And fourth, Phones or circular or scrub method. Fifth one is vertical or Leonard's method. Sixth, Charter's method. Seventh, scrub brush method. And eighth, roll technique. And ninth, physiological or Smith method. We'll be dealing with all these 9 methods today. So moving on, we'll have a small demonstration of toothbrushing techniques with a model which I have prepared. Sorry about the painting, and a normal preformed dental model which we have in market, and a brush. So we'll be discussing about all 9 brushing techniques. So starting with the most acceptable and adaptable method called Bas method. So in graduation we'll be having very much confusion in this Bas method, how to go about it. So first and foremost thing, so the bristles are placed at 45 degrees angle. This is wrong way. For demo purpose I am placing it the bristle for accessibility. So bristles are placed at a 45 degrees angle which touches half the gums and the half the tooth. So it is placed like this, where it touches half the gums and half the tooth. So it is engaged into the gap between the tooth and the gums. So after that, small circular motions are given. So this is Bas method. Bristles are placed at a 45 degrees angle and small circular motions are given. So for the occlusal surface also there is adaptation. So for the occlusal surface we adopt like this. Press the bristles against the pits and fissures. Adopt like this. So later, due to some disadvantages of the Bas technique, there is one modification of Bas technique where sweeping motion is added into it. So the same holding the bristles at a 45 degrees and small circular motions and limiting to the 3 teeth. Along with it, we have a sweeping motion from cervical to the incisal surface. So placing the bristle at a 45, small motions, sweeping motions towards the coronal to the incisal position. Likewise we can see it in lower. So when it comes to Bas or modified Bas technique, the basic rule is for the upper tooth the bristle should be somewhat slightly upwards, and for lower tooth the bristles are somewhat lower. Sweeping motion is this is sweeping motion. So coming to the next one is modified Stillman's technique. where the sides of the bristles are pressed against the teeth and the gingiva. While brushing the tooth, the brush is moved back and forth and in coronal direction like this. So brush is placed at an oblique direction, oblique angle with the tooth, and back and forth are given, and bristles are positioned partly at the cervical aspect of the tooth and partly at the adjacent gingiva like this. And no sweeping motion and no circular motion, back and forth movement. This is modified Stillman's method. And for each and every brushing methods we give 20 strokes for it. This is back and forth at an oblique direction, pressing the gingiva and the gums. No sweeping motion here. This is modified Stillman's method. So next is Fohn's technique or circular or the scrub technique. Only it is advisable only in the children where the brush is placed perpendicular to the tooth and circular motions are given. So to be precise, Fohn's technique is like this, where bristles are placed perpendicular and the circular motions are given. That's why it's otherwise called as circular technique. So next comes the vertical method or Leonard's method. So in Leonard method, it is as same as Fohn's or circular method, but the bristles are placed at a 90 angle, but the teeth are placed at edge to edge, not like this with a gap in between. So the teeth are placed at edge to edge. For example, like this. So edge to edge, these are placed edge to edge, and the bristles are placed at 90 degrees angle. So in this, the teeth are placed edge to edge, and small circular motion is given, and the bristles are placed at 90 degrees angle to the tooth, and up and down, and circular motions are given for slight circular motions, not vigorous slight motion, circular motions. Slight circular motions are given with edge to edge, up and down movement. So this is vertical method or Leonard's method. And the other technique, which is Charter's method, the second most important brushing technique, which we use as a periodontist. We advise for a periodontal surgeons. Periodontal surgeons to pay for the patients which they have undergone the periodontal surgery. Like Charter's method is a special indication, that is method for implementation of brushing for individuals with open individual spaces, or with fixed partial dentures, or with orthodontic appliances, or patients who has undergone periodontal surgery. And even for the gingival recession cases, we advise this Chartered method. Okay, and bristles are placed at the bristles are placed at 45 degrees angle and towards coronally, like they are placed at the coronal region, and mild vibratory strokes are given ending at the interproximal areas. So the modified Bas technique gives a vibratory motion and it sweeps around. So in Charter's method, so there is the whether if the braces are present here, so the bristles are placed like this, given, and brushed like this, to and fro motion, mild vibratory strokes, and at the pressed against the interdental spaces. So this is Charter's method. Moving on to scrub method or scrub brushing technique. It is a combination of vertical, horizontal, and circular motion. It's a freestyle brushing method. So the bristles are placed like this: horizontal, vertical. This is vertical and horizontal, and circular motions. This combination of these three, this is called scrub method, which all the individuals will do very often. This is scrub method. All the teeth, even in the lingual side or at the tongue side, will do like this. This is horizontal and this is vertical, and circular motions. So coming to the next technique called roll technique or rolling stroke technique or ADA method or sweep method. So even in roll technique also, the bristles are placed at 45 degrees angle, and across the occlusal surface. It is placed like this. Half into the occlusal and half into the coronal portion across the occlusal surface like this. So this is placing of bristle at a 45 degrees across the occlusal surface, and rotatory motions are given in roll technique. So placed at 45 degrees angle to the tooth, touching the cervical and the occlusal surface, and rolling. So placing the bristles at a 45 degrees angle, touching the occlusal surface, pressing again at the occlusal surface, and rolling the teeth. So this is roll technique or the sweeping technique or ADM method. So coming to the last and rare method called physiological method, which we don't practice in either in even the practitioners won't do it and even the patients won't do it unless and until there is proximal or the occlusal surface foot lodgement. Like if the foot are present in the occlusal surface, it can be implemented. That is called physiological method or Smith method or Bell method, where the bristles are placed at the occlusal surface, pressing along with the occlusal surface pits and fissures, and moved along the occlusal surface. As simple as that. So placing the bristles on the occlusal surface, pressing along with the pressing or activation of bristles, and moving along the occlusal surface and the incisal surface. So this is brief introduction regarding the brushing techniques which we implement and we practice. So we periodontists and the surgeons will be advising the Charters method, and in regular general practice we will be advising modified Bast technique, which is effective for cleaning the interdental spaces and the gap between the gums. So better advice in clinical practice, better advice modified Bast technique and Charters method, and for the children we advise Phones technique. So with this I conclude the short video of brushing technique. Hope you learn and understand what method is used and where it is used.